Medicare laws enacted by Congress say a patient becomes qualified to have Medicare pay for skilled nursing home care if he was a hospital inpatient for 3 days in a row. After more than 1 week in a Connecticut hospital, Larry was disqualified for Medicare nursing home coverage because the hospital kept him on observation status. Larry's wife, Lee, remembers how she found out.
On the 5th day, a neurologist, flanked by Larry's doctor and a social worker, ushered me into the hall and said, "We're sorry, but your husband was never admitted." I was stunned with disbelief.
I'm John Roberts, an elder law attorney for people in Hampden County, Massachusetts. Hospital observation status cancels Medicare nursing home coverage. Being admitted to the hospital is key to qualifying for Medicare coverage of extended care in a skilled nursing facility. Regulations say Medicare will start paying for up to 100 days of nursing home care, as long as the inpatient of a hospital had a medically necessary stay of at least 3 consecutive calendar days. You must be in the hospital for at least 3 midnights after your day of admission. At midnight after day 3, you qualify for post-hospital extended care services. The day of discharge does not count. A self-help guide from the Center for Medicare Advocacy suggests you find out if you are only in the hospital for observation. If you are, try to get that status changed to inpatient. If you're not successful with changing your hospital observation status and you can safely return to home, ask your doctor to order home health care. As long as you are homebound and require skilled care like physical therapy, Medicare should pay for this care at home. Because Larry needed 24-hour skilled care, his physician could not allow him to return home, so Lee had no choice.
After stabilizing his blood pressure, he was released on July 10th and taken by ambulance to a rehab facility as a private pay patient, since the 3-day rule did not apply. He remained for 3 months, suffering various symptoms and becoming increasingly despondent.
Nursing homes cannot bill Medicare if you were not an inpatient in the hospital. Lee decided to appeal as soon as she found out Larry was not an inpatient.
I tearfully blurted that I was going to fight this, whereupon Larry's doctor and the social worker both gave me the thumbs up sign, saying that this happens at least once or twice a week.
Even if you appeal, the nursing home will require you to pay while you wait for Medicare to decide the appeal.
I eventually had a hearing where everyone felt the results were very positive. 6 months later, it was denied. I keep thinking of past and future victims who might not have the awareness level or tenacity to navigate this economically driven system.
If you want to try to get Medicare to reimburse you for a nursing home bill that you paid, gather hospital and nursing home records to prove your case. To learn about Medicare days, Medicaid nursing home coverage, and how Medicaid at-home care programs could apply to your case, call to schedule an educational meeting.